Welcome back, everyone. Brandon Fischer is with us today, Allen County's Health Commissioner. We're doing a little update on the COVID situation. I almost like to whisper, like, well, things seem a little better right now. Give us a kind of a status update.
Yeah, it seems like we are doing a lot better with our cases right now. So if we want to look back about a 4-week period ago, we had 350 cases reported to us in a day over a 7-day period of time. Now we're down to about 18 cases per day. So we're seeing a dramatic drop in cases, about 20 times less number of cases per day that are coming in. Still seeing people get hospitalized, but hospitalizations are down. It's looking better, just kind of on the lookout to make sure that nothing else is coming down the road or trying to offer that additional protection to prevent any hospitalization and deaths.
Yeah, because we were talking too, and it's been months and months ago before Omicron really became the the dominant strain. There was I joked there, and it seemed like there was about a 2-week period where we thought, okay, I think we were kind of ebbing, we're kind of doing okay here, and then things got worse. But there seems to be no sign of that worldwide anyway.
Yeah, right now cases are falling not only here but across the states and across the globe, where we're starting to see that Omicron wave that just went through the globe in about a 3-month period of time. Really not seeing much in the way of new variants or nothing new that's coming along the line. So we are seeing hopeful signs, and don't want to say it too loud to jinx us,
I
but
know.
it's looking better than where we were even a month ago.
Yeah, I heard a doctor the other night say the best thing for us is to build up our immunity through vaccines and our own body's ability to do that and be one step ahead of variants. Is that too simple of a thing, or is that kind of the truth?
That's pretty much what we're advocating. Vaccines do a much better job of getting that immunity into people with less consequence to them. So you do get immunity from having the infection, but you don't have the risk of heart conditions or ongoing long COVID symptoms. So that's where we're really pushing vaccines for people who haven't gotten vaccinated. Get their first, second dose of vaccine. And if you're eligible for the booster, go out and get that booster shot, because it does offer massive protection against hospitalization and death.
Yeah, the CDC this week had not, it sounds like they're close to changing maybe some mask guidance. A lot of states have pulled that back. Do you still have thoughts on it? I know when I go grocery shopping, those kind of things, I'm still wearing my mask. I'm still nervous about it. Any thoughts on what we should be doing?
I'm still advocating for masks indoors, but we're doing a daily evaluation and looking at where we're at as far as cases are concerned. We're getting close to that threshold where the CDC would say you no longer need to wear a mask indoors. So that's where we're at as far as cases. We're not there yet. It may be a couple weeks, it might be a month, but we're getting pretty close on that. And if CDC changes their guidance, we'll evaluate that with the state health department and pivot from there.
Along those lines, with cases coming down, I know months ago we talked about another booster coming up. Do you think that's a wait and see? Will there still be people saying, maybe you need a booster here at the end of the winter?
It's going to be a wait and see, just to see if there's going to be that 4th dose that's needed. Israel did a study to see if the 4th dose was going to be effective against Omicron. They really didn't see the positive effects out of that, but that 3rd dose of the messenger RNA vaccine, or if you had the Johnson & Johnson getting that 2nd dose, really does offer that higher level of protection against symptomatic illness, severe illness, and death.
It really is true that when you have a 1 in a 100-year pandemic, that as for what you do for a living, that's got to take up all your time. I joked with you, years from now when you're retired, will you look back on this? But does this give you a chance now to kind of think, okay, we've got so many other areas at the health department that we deal with, maybe we can start dealing with some of these again? Yeah,
we're already starting those discussions. So the pandemic, while it was a curse, it also brought some new players to the table that we can work with, collaborations to assist the community and assist individuals who are homeless, individuals who low income or have additional needs of assistance, where we can identify those individuals. We had upgrades to data systems and continued upgrades to data systems, where we can look at what are the needs of our community and what can we do to protect the community moving forward.
Yeah, keeps you busy, that's for sure. Brandon, thank you, appreciate it. Good seeing you. Don't go away, more medical news coming up next.